video. Chloe is not sick. She's actually really healthy. You just come across some problems, developmental skill wise. Part of it might be through my pregnancy. Part of it is just delays. We have gotten help on it, and we're continuing to getting help. But it all started when I was pregnant, which I will show you right now. I was pretty big. I ended up getting induced at 41 weeks. Chloe was pretty big too, at least that's what they thought. And so while she was in me, she was kind of in a pretzel. Her legs were in a pretzel like this. And she didn't have enough room because she was big. So her legs were always like this even when she moved. So when I gave birth to Chloe, she was 8 pounds 6 ounces, which is a pretty big baby. And her legs were in the pretzel shape. Right when she was born, they were like that. They put her on my tummy and her legs went out like a frog. And I was, I was like, okay, she's a little bow-legged, which I will show you right now. Like that, for about 3 months, her legs were always bow-legged. And that's actually very common with babies. It's very normal, and it's still normal even when they get older, even when they're like 1, 2 years old. But the bow-leggedness really didn't get me. It was the way that she was using her legs. About 3.5 months, she was rolling from her tummy to her back, which is completely normal where a baby should be. But she wasn't rolling from her back to her stomach. And I was like, okay, well maybe she's not ready. So I let that go. And then by 4 months, if you hold a baby up by their torso, they'll put weight on their legs. My daughter did not put weight on her legs. She fell limp all the time. She didn't put no pressure on her legs or her feet. So I was like, okay, well, maybe she doesn't want to use them. She might be lazy, and okay, so she might be a little behind. Every baby develops differently. So when it became 5 months, I also started noticing that she wasn't sitting up. At least she didn't try to. Even if I put a boppy behind her, she didn't sit up. Now, I brought this up to my doctor at every single appointment, from the day she was born till about 5 months. And she's like, oh, she's fine. We'll just keep watching it, see what happens. So I was like, okay, I rubbed it off, and we moved on. And so 5 months, she's still not sitting up. She's not rolling from her back to her stomach. And she's still not putting pressure on her legs. Well, 6 months comes, and I brought it up to her doctor once again. And I said, listen, it is 6 months. She's not doing any of these yet. As a parent, I feel maybe something might be wrong. Maybe I need to get it checked out a little bit more. Because every baby I know that I'm friends with, or their mom, that baby is right where they should be. And yes, she might be a little behind, and that's okay. But I don't want her to get too far behind. So my doctor said, okay, I'll write you a referral for this thing called early interventions. So they were going to have a physical therapist, a speech therapist, and an evaluator come out and look at her and see if she qualified for physical therapy. Well, when they came to the house, they did their evaluation, and you're supposed to get a 5.0. She got a 2.0, so she was behind. And they sat me down. They said her speech is amazing. She's babbling, she's talking, and she's really good with her motor skills, meaning picking up things, putting them in her mouth, touching things, touching textures, clapping, doing her so big. But one thing they noticed she wasn't doing was her gross motor skills. Now, I'm going to show you what the definition of gross motor skills is. Bigger movements of moving, twisting, hands up, rolling over, sitting up, and putting pressure and standing on your legs. So within a few weeks of doing paperwork, meeting with a caseworker, we finally got our physical therapist, whose name is Gail. She has been a physical therapist for 20 years. She's in her older ages, which I loved. She is awesome. Me and Chloe love her. So she came to our house for the first time, and she looked at Chloe, and she's like, oh, she's so cute. She noticed we had a boppy behind her, and she's like, we don't want this boppy. We don't need this boppy. And she took the boppy away, and Chloe fell right down. I always have to lay Chloe down because she doesn't sit up. Well, within 2 days of our PT advisor working with us, we had her sitting up with assistance, but the boppy wasn't touching her. It was just behind her in case she fell, and she would sit up. Now, if she somehow like twitched or something or got really excited, she would fall over. So with that, we started working on her putting her hands down, and so she would grab herself from falling. Well, she started sitting up by herself, so I was like, okay, there's one thing that we have worked on that is now improved. Our next step was working on moving from our back to her stomach. She favors one side, so she moves like this and goes under her tummy. Well, after 2 weeks of doing that, she finally has gotten the concept to roll over, and now she's just rolling constantly and she doesn't stop. And now she will stand up if you hold her and her feet are flat, and she just laughs at you now. So because of her not using her body movements and stuff, she has a gross motor delayed development, which this physical therapy can lead up. Our goal for me, Chloe, and our PT advisor was walking with assistance. So she's gonna be on PT probably for a while. She's actually now where she should be. I mean, she might be a little tad behind, but really she's not really far from where she should be at 8 months. We have exercises that I have to do twice a day with her every day. We meet twice a week for 30 minutes for her PT. My girlfriend, Tasha, who you all know, also works with Chloe. If I'm busy doing dishes or something, she'll work with her, and she'll do some of her exercises with her. We'll stand her up. We'll put her on her tummy, and we just do a lot of practicing with her. I'm going to show you a few pictures of some of our PT sessions with our physical therapist. We actually have physical therapy coming up Tuesday at 2 o'clock. I'm probably going to be taking more pictures. I like to capture and see how the development is actually going. She's gotten really far. She's now clapping, she's rolling, she's sitting up, she's standing with help, which is awesome. Like, she's right where she should be. So the PT is exactly what we wanted for her. Basically, we just had to work on her core, which is from here down. We just had to make it stronger for her. So her legs are now working where they should be. Always, you know, people would stand her up and she just went floppy, and now she can actually stand up. And I love to see her do that. I love to see her growing and starting to move where she should be. And it's just awesome. And without Gail, I honestly, and without our doctor not, you know, consenting to it, I don't know where she would be at this moment. She'd probably be even further behind. A lot of people said, oh, she's just lazy, give her time. But I didn't want to give her time. I don't want her to be too far behind, so when she's a year old, she's still not using her legs or something like that. Now, if she's a year old and she's not walking yet, so be it. You know, if she's a little behind, it's okay. Because we know that we found the problem and we're working on it. And that's what matters to me. It's my girlfriend and my daughter. So we will be continuing PT for as long as we need to. We do it through step by step. And our PT advisor is Gail. And yeah, so I hope you enjoyed the video. Thanks to everyone who said prayers for us, that the PT would be involved, because it finally happened. We're happy that we got it, and we couldn't be any happier. So thanks for watching. Remember to like, comment, and subscribe. I always subscribe back if you're not private. If you're private, I obviously can't. So thank you for watching.